Hi, I'm Brittney Meyer. I'm a professor of pharmacy practice with the South Dakota State University College of Pharmacy and Allied Health Professions for the pharmacy program. I also serve as our college's interprofessional education coordinator, so working with different programs to get health professional students together so they can learn from, with, and about each other. I've been at SCSU for 11 years and more currently in my role as IPE coordinator in the last year. So much of my research is focused on the scholarship of teaching and learning, or looking at the impact of innovative teaching strategies on how students learn, and even more specifically, those interprofessional education activities and centered around simulation. So my first big research project as a faculty member was looking at if high-fidelity interprofessional simulation could increase knowledge retention of pharmacology topics for both nursing and pharmacy students. And I've written 2 book chapters on low-fidelity simulation in the pharmacy practice lab, so for other pharmacy lab faculty members, and how to implement simulations on counseling difficult patients or culturally responsive counseling. I also teach our immunization delivery content to our pharmacy students, and that with my service to the profession, I partake in a lot of flu vaccine clinics. I also serve on our Brookings County Pandemic Preparedness Coordination Committee, and through those activities, I collaborated with the SDSU poll to survey South Dakotans on how different messengers might affect their intention to get their COVID vaccine. As faculty, I also get to work with a lot of students completing an independent study project, maybe in order to get their honors college distinction. And with that, I've mentored students who have looked at the impact of medication synchronization on pharmacists and on patients. Also, a student surveyed practicing pharmacists in the state to learn more about different drug information resources used and their differences. And then also measuring baseline knowledge of high school's OTC medication use. Due to COVID, we had to adapt many of our teaching strategies. So my current research is looking at an interprofessional poverty simulation that was offered live in person before COVID, and then post-COVID we moved that to a virtual experience, and we're looking at the difference in that impact on students' learning. A nursing colleague and I will be presenting our findings early next year at the International Meeting for Simulation in Healthcare. I am interested in learning how best to teach students new skills, so whether that be sterile product preparation or medication safety issues, or best communication techniques such as through motivational interviewing. So those skills take time to develop, and so learning the most efficient and best way to teach those students and then make sure they are using and applying that knowledge. I think that can also translate to pharmacists, so what's the best learning method for pharmacists to learn a new skill and implement that, and the impact that that can have on patients in the community. So whether that be through the impact pharmacists can have in motivational interviewing, or through healthcare screenings to prevent disease progression, and things of that nature. I strongly believe that collaboration is the key to success, so I am excited to be a part of CPIC to meet others who are interested in similar topics or needs or ideas to pursue. And so I hope this video maybe will also allow that conversation to start, and whether that's through students or pharmacists or other community stakeholders, I look forward to seeing future collaborations come from CPIC.